Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
Hello and welcome to Boomer Life here on CIL 650. It's nice to have you with us today. We're going to talk on the program today with the people from NeuroKinetics Clinic in Vancouver. And the subject of the program today is trauma impact and disconnect. And we are delighted to have in studio with us the founder and president of NeuroKinetics Clinic. Dr. Philippe Souvestre is with us, along with Sonia Dale, the clinic manager, and J.C. Gordon is back with us from the Department of Liaison and Logistics. Welcome back to all three of you.
Thank you. Hello.
Pleasure to be back here, Sterling.
It's good to have you with us. And Dr. Philippe, let me go right to you, sir, because we're going to talk about trauma impact and disconnect on the program. So let's just lay down some fundamentals here. What are we talking about? Talk to us about what you mean by trauma impact and disconnect.
This is a fundamental question to understand the rest of the show today.
Right.
When we get hurt, we get adversely impacted, which translate into being affected adversely or negatively with losing performance on one hand and being the object of a rise of symptoms. It is a simultaneous phenomenon.
Okay, so the impact is a combination of those two characteristics.
Leads to that.
Okay.
Yes.
And so where does disconnect come into the conversation?
So the disconnect comes from a multifactorial equation, which I pass on, of course, in this today. But in short, you compare the brain to a computer in which you will have a software and a hardware.
Okay.
The hardware is the anatomy that substantiates everything, and a single thing we can express is allowed by the anatomy, which when it works reflects physiology, just to acquaint those who are listening to us today. And the disconnect is due to lowering and weakening of this cognitive processing, which is the software the brain needs to rely on to perform.
Am I safe, JC, in interpreting the word disconnect by literally assuming it means what it says? You literally become disconnected from your life, your family, your friends, your normal routine because of the impact of some traumatic event in your life?
Absolutely, Sterling. And what first happens is individuals realize that they're not the same person that they were.
Right.
They're not able to perform the way they like to. And as a result of that, they start withdrawing. They start to remove themselves from their life. It could be their family. It could be their work. It could be just what they were used to doing on a normal basis, simply
right.
because internally they know that they're not the same person that they were prior to. And I've heard it so many times that when people call us, they just have no idea where to go or what
right.
to do. They've tried so much, they haven't been able to turn the light switch on, if you like. And as a result, they've lost hope, and they start to remove themselves
Sure.
from their daily life.
Right. And of course, once you start that process, it becomes even easier for the people around you to go, well, whatever's wrong with so-and-so, they apparently don't want to be mixing with us much anymore. So let's just let them go.
That's so true, Sterling, because everything is energy. And as human beings, we have the capabilities to want to involve ourselves around positive, uplifting energy.
Sure.
And kind of remove ourselves from that energy of fear and negativity, and unfortunately the disconnect sends out the energy of negativity.
Sure,
and it's
sure.
not something that people enjoy being around.
Right. And Sonia Dale, just to follow up on what JC was talking about, because you're the person who responds when we call NeuroKinetics Clinic. We send you an email. It's likely that you're going to see it and send something back.
Yes.
We pick up the phone and give the clinic a buzz. It's likely to be you on the other end, or we'll certainly get you before the end of our call. How many people reflect the kinds of symptoms and conditions that JC was just talking about? Literally call you up and say, I found you on a Google search, or I heard about you from a friend or whatever. And to be honest with you, I really don't know what's wrong with me. All I know is I got banged up in a car accident, or I fell, or whatever. And since that event, my life has just gone straight downhill, and I feel like it's starting to slip away from me. But honestly, I still don't really know what's wrong. Do people tell you that?
They do. I would say majority of the calls are all the confusion in the air.
Sure.
They just need clarity to find out what is really wrong with them. They're unclear on the fact of, why am I not sleeping enough? Is it related to the fact that I had a traumatic incident in my life? Was it due to a fact that someone's passed away that they've known of, that they haven't really clearly gotten over that incident? What is it from? Lo and behold, and a lot of majority of the time when they do come in, they sit with, Dr. Philippe, where they're going through the thorough medical history review. They have not one, but they have several things that play an effect with them isolating themselves from family members, as JC was saying,
right.
From the workplace, from relationships have gone downhill because of the fact that they just don't want to be leaving their house.
Mm-hmm.
So that's a lot of what I hear majority of the time when they do call in is, what's wrong with me? I don't know what's wrong with me. Is there even something wrong with me? Is what I usually hear on the phone.
Right. And Dr. Philippe, when they come to you after Sonia says, well, yeah, we'd love to see you. You're the kind of person we specialize in. When these people come and sit down and tell you essentially the same thing they told Sonia on the phone a few days before, and they look you straight in the eye and go, Doc, I just don't know what's wrong. I do know that something is definitely wrong, but I couldn't begin to tell you what it is.
This is a constant. This is a constant in everyone coming to see us. It has to be understood as well that disconnect doesn't only apply with outside things. It also applies to within ourselves.
Okay.
And that is the worst place to be when you lose that internal and innate connection which makes us a whole being. Mm-hmm. When there is a disconnect at that level, it brings a lot of anxiety up to the surface.
Almost as though you're giving up on yourself. Huh?
No. It doesn't mean giving up. It is being forcefully disconnected beyond will.
Oh, okay.
It's not an act of will to be disconnected. It is something that you become a victim of.
You just feel life slipping away from you.
Yes, and that leads to extreme anxiety and sometimes panic attacks, mm-hmm. because there is that deep disconnect which will prevent somebody to fall asleep peacefully and calmly, just being that cold loneliness,
right,
which is a forced state. There's no room for choice. You just fall under that darkness. It is really a feeling of darkness, and that word of darkness is constantly used by patients.
I would say yes, darkness is the main word. I actually remember just receiving a call probably last week or a few weeks back, and that was the main word that was used, darkness. Or even actually they identify if they can't describe the function in their brain of how it's functioning. They say, I almost feel like I have a blockage in my brain.
Interesting.
I almost feel like there's a black bubble or a black cloud somewhere just foggy.
Yes.
Yeah.
Right.
Some of them call in and say, why do I feel like my body is present, but yet I'm not present? That's the way they describe things to me as well. And by all means, we're here to help, and that's where we, encourage them to come on in when they're, willing to.
And I would think, too, JC, that in a lot of these cases, people are on the verge, especially just going to listening to Dr. Philippe and his description of what happens when one disconnects or is disconnected. People start to lose hope once you pass a certain threshold and a certain ability to interact with other human beings. If you're sort of feeling isolated to the point where interacting with another person is frightening, then you've got some problems, haven't you?
You certainly do, Sterling, and compound that with the fact that unfortunately the way the Western medical system operates today, all they can really do is manage you with these drugs that darken the cloud, if you like, that increase that darkness, and a lot of times when people come to see us, they're in a downward spiral,
right,
and moving downward at a rather quick pace.
Right. So, Dr. Philippe, you wanted to jump in here because you were taking notice as JC was talking.
And JC initiated what I wanted to add, which I will complete now. It's exactly true. It's exactly the tragedy of those patients who are misunderstood and not acknowledged in what they say. The usual attitude in medicine when you have only 20 minutes available is to apply a patient situation to whatever chapter or lines in a textbook you have learned at medical school.
Right.
You don't have the time to dig or investigate the real world.
Right.
And that is the big gap that deteriorates further those patients because they are given prescription drugs which are not a fit for what we know now in brain neuroscience.
Right, and
this is written in the
And given that a typical experience with a medical provider is in the 10 to 15 minute range, Sonia, patients must be just absolutely floored when they find out in order to get into the program and have Dr. Philippe work as their advisor and develop a program to assist with whatever problems they have, they're going to see the doctor for a minimum of 12 hours. Before treatment even begins.
Yes, and even prior to, the main consultation appointment, we take anywhere up to 45 minutes to an hour just for the main consultation appointment.
And that's just learning about what the clinic can do for you should you choose to avail yourself.
And that's answering their questions that they would have. That session is for them.
Right.
We want them to walk in those doors, walk into our clinic and feel comfortable, feel that their questions were answered, and they can feel comfortable moving on to the assessment stage. That's where the true work does begin on our end, from the assessment stage for Dr. Philippe and for the rest of the staff.
Okay.
I want to share also the social impact of such a disconnect, which is totally mute and invisible for somebody outside of a given individual.
Okay.
It is extremely difficult to observe unless one spends time to connect with the patient and actually get into that place and trust the patients enough in what it is reported. What I would like to say here for the public out there is that it is one of the main sources for addiction, leading to addiction.
This disconnect,
this is a social issue.
So it becomes self-medication in some ways,
it is
right?
Searching for a solution,
right?
Compensation somehow, and it is a dark place to be.
Mm-hmm. And drugs and alcohol seem to offer some relief, however temporary. And off you go onto an even more negative pattern of behavior. Interesting stuff. Our guest from NeuroKinetics Clinic, which, by the way, is at 3195 Granville Street here in Vancouver, and online at neurokinetics.com. Our guests are Dr. Philippe Silvestre, who is the clinic founder and director, and also we have Sonia Dale, the clinic manager, and J.C. Gordon, director of liaison and logistics. The gang has assembled, and we're going to add one more member to our conversation when we return on Boomer Life.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIL 650. This is Boomer Life on CIL 650.
Welcome back to Boomer Life here on CIL 650. Our guests from NeuroKinetics Clinic in Vancouver are in studio with us today. They are the president and founder, Dr. Philippe Silvestre, along with Sonia Dale, the clinic manager, and also to my left, J.C. Gordon, director of liaison and logistics. Of course, it's radio. They can't tell, can they, J.C.? We're talking on the program today about trauma impact and disconnect. And Dr. Philippe has done an excellent job of describing what that is, and especially the disconnect thing, JC. And that's a phenomenon that I don't think, unless you've experienced it personally, when you have some sort of traumatic event in your life that causes your brain to begin strategies for coping and just getting on as best you can, which causes you literally to disconnect from the whole wide world. Unless you've been through that, it's a tough one to relate to, isn't it?
It really is. And Sterling, the unfortunate part of the disconnect aspect of this whole phenomenon is it is something that is not addressed out there.
Right.
It is something that the medical community has not been able to put the finger on and say, oh, we know how to help you.
Right.
They just haven't.
Doug is on the line. Doug is a business professional from here in Vancouver and a patient, or at least a former patient, of NeuroKinetics Clinic. Doug, thank you for joining us, sir.
You're very welcome.
What first brought you to NeuroKinetics, Doug, and how did you find out about it?
Well, I found out about NeuroKinetics because Philippe knows how to fly. And a close friend of mine is also a flyer.
Mm-hmm.
And a close friend of mine is also, a business coach and interested in personal development and things of that sort. So
right.
He knew about what Philippe did. He understood it reasonably well and that kind of thing. And I had been talking with him about the difficulties I was having with, what you're calling disconnection.
Right.
I had previously been to Dr. Swingle's clinic here in Vancouver and did some I think they call it neurofeedback, and got some benefit there. And then I went to Daniel Amen's clinic in California, where they use brain scans, and their primary diagnosis was what they called an ADHD-like phenomenon.
Okay.
And they diagnosed also that I had some kind of damage to my temporal lobes of my brain, which they speculated had happened at birth. That the doctor may have used forceps to pull me out, there's a difficult birth.
Right, yes.
And placed forceps, and I decided, basically put your head in a kind of a grip and pull you through.
That's true.
And my sister confirmed that my mother had told her that I'd had that. And anyway, I was really finding myself disconnected. The real problem was making my business cohere. I was capable of doing really brilliant work on specific projects and that kind of stuff, but having it actually hang together was defeating me, and I felt disconnected from other people, and the whole thing was mysterious to me.
So it's interesting, Doug, because it sounds like it was sort of you were functioning on two levels at once. As a business professional earning a living, you were able to conduct yourself fairly effectively and develop strategies for clients and so on. But on a personal level, you were just really shutting down by the sounds of things.
Well, yeah, but they both cross over. It's like what I was not doing successfully was assembling all the different bits of work I was doing professionally.
Okay.
In business.
Right.
When I had a really narrow focus established by a relationship with someone else, a business relationship with someone else, I could do really, really well. But when it came to kind of stepping back from that and making it all come together, something was missing. And, I've done personal development. I've been to therapists, that kind of stuff. I dealt with a lot of things. The people at Daniel Amen's clinic had shown me some, it's really quite, frankly, it's a little bit creepy to look at a scan of your own brain.
I'll bet it is.
It's really quite creepy is a good word. And they showed me places where, clearly I'd had injuries.
Interesting.
But after about 3 years of using Amen's treatment, I realized that I wasn't getting to the root cause, and I was experiencing side effects from the drugs I didn't.
I was just going to say, when you because you talked about having gone to see other practitioners, both here in Canada and down in the States, and receiving diagnosis for this, that, and the other thing. As a consequence of being diagnosed with these conditions, Doug, were you given prescription drugs? Was that part of their approach to dealing with your disconnect?
Well, Swingle, no. He has a specific method he uses that in some cases was very effective, but was only mildly effective for me.
Okay.
What Amen did was a combination of drugs, and he put me on a drug called Neurontin, and which is widely used off indication. And it didn't really have a good effect. It really quieted an enormous amount of noise in my brain. I was able to focus on what was happening much better.
Right.
And a friend of mine who recommended I go to see Philippe. Before I did that, several years before I actually went and saw Philippe, I was just 3 weeks onto Neurontin, and the people down in the clinic said, after about 3 weeks this will kick in. And on the 21st day, I walked into the office I shared with my friend. He said, "What happened?" I said, "What do you mean?" He said, "You just looked at me for the first time as if I'm actually here."
Ah. Okay.
And I said,
as in making a connection kind of thing.
Yeah, right.
Right.
And I said, I'm just 21 days on this Neurontin stuff that Amen gave me, and I guess it's working. And because you see, I had no idea. This is something that goes back to birth. I've lived my whole life with it. I had no idea that I was missing what I was missing, and that I was doing what I was doing. It was reality.
That's fascinating. It really is.
I just had no way of I had no experiences that could give me a perspective. I couldn't step out of the box, and see what was going on.
So how did you manage to, when you started going to NeuroKinetics? Was that the first time, Doug, after seeing all of those other clinicians and practitioners, was your intake, your assessment phase, and then the treatments at NeuroKinetics, did that allow you, perhaps for the first time, to completely understand what the heck was wrong with you?
No. The brain is a really mysterious place.
I believe that.
And I don't think we all, I got some indication. The really important thing about Philippe's method was the way that his way of diagnosing people was, it's about things like balance and how your eyes move and that kind of stuff.
Mm-hmm.
It gets right to that place where the way you think, the parts of your brain that do the thinking are really intimately interwoven with the parts of your brain that guide your eyes and govern your balance and the movement of your body.
So even from those initial 4-hour assessment that you'd had to do 3 of before you even began a treatment program, the doctor was able to already determine that there were certain things that you could identify, Philippe, what was going on. You were able to start putting 2 and 2 together just going through the assessment process.
Yes.
Interesting stuff. So, sorry, Doug.
Well, he could tell he had advice that you stuck in your shoes, and he had me stand on one of them, and as if they were in my shoes, and he could see an improvement immediately in how I was functioning, and BREs he calls them. And so that's how he knew he would be able to help me.
Interesting.
But for me, I didn't. All I knew was that something was disconnected. The thing about Philippe is he works with structures deep in the brain.
Right.
Swingle doesn't. Swingle works at the surface of your brain. And his stuff is valuable, but whatever was bugging me was deep in my brain.
Of course. Well, if it goes back to the day of your birth, it's kind of deep, about as deep as it gets, isn't it, Doug? So how long ago did this all take place? And the reason I'm asking you about a timeline, Doug, is because if it's been a while, do you go back for sort of tune-ups, if you will, an annual visit kind of thing, or are you still in active treatment?
Oh, I see. Well, it's about 8 years ago.
Okay.
It has taken me really that entire period of time to integrate the changes that Philippe's treatment made. I found out in the wake of it that what he does is he causes certain neural circuits to start working that have shut down. And so you start having experiences you haven't had since the circuit shut down. And I hadn't had a lot of them. There were traumatic events during my life, but there were a lot of experiences I hadn't had at any point in my life.
Right.
And I had no context for that, no way to understand it. But I was just suddenly inundated with all kinds of signals, like social signals.
Oh, okay.
Sensory signals, and literally the balance, physical balance. I was just overrun with just stuff that I either hadn't experienced for decades or had never experienced since the day of my birth.
Right, right.
I had no idea. I didn't know who I was anymore.
But at least you were able to at least identify with knowledge that Dr. Philippe was able to supply to you. Here's what's wrong, and here if you're experiencing this waterfall of emotions and experiences, it's because this happened and that happened. So armed with information, at least, Doug, it must have been somewhat helpful as you were overwhelmed by all of these emotions, etc.
Well, I knew that I had a new brain, and in a sense, but I didn't have an operator's manual for it.
Right, right.
And so I spent the subsequent time doing things where actually learning to live with this was a completely different thing from having the procedure done.
Right.
And I didn't really. The only thing I really knew was that a whole lot of circuits had been reconnected, and a lot of them were in the corpus callosum, the communication between the two halves of my brain.
Right.
And that I had to learn how to use this thing, and a lot of what I was dealing with was signals from from very early stages of my life, right? I wound up getting involved with a couple of programs. The most important thing was getting involved with a long-term program involving other people in which we were trying to do something with our lives. So I was part of something run by an outfit called Warrior Sage that does personal development.
So there you were, connecting with other people who were experiencing disconnect.
Basically, yeah. And maybe not for the reasons I was.
Right.
But the program was called The Gift of My Heroic Journey. It was about taking what has happened to you in your life and composing a workshop and articles and stuff like that about it, and then making it, selling that to other people, making that available to people, because your journey is helpful to other people. So I was in that program for about a year and a half, and that was what enabled me to start putting things back together again. And then I had a long-term assignment with a really, really good client. And around the same time, I got involved in a program run out of New York City called the Evolutionary Collective. And I was in that for 3 years.
Right.
Worked with the client for 3 years. So what it was being in situations that were being structured by someone else, in which everybody involved was learning like crazy.
Right.
To solve the problem.
But the energy that sort of got you going to seek out those programs and join up with other like-minded individuals and improve the quality of your life all came about because of the information and the initial experience with Dr. Philippe at NeuroKinetics, correct?
Well, that's half of it. The other half is I already had a long history in personal development.
True.
I already had a long history in my profession. And that's where the opportunities to do this other work came from. And that's where the awareness of what I should do about this came from.
All right.
And so combined with what Philippe really provided was a new, he made me malleable. Most people, I'm 66 now, and that was in my late 50s. Most people in their late 50s, their brains are locked down the way they're locked down.
That's right.
And you can go through a lot of neurodevelopment late in life.
Right. You're never too old.
Yeah, I know. But what Philippe did, he kind of kicked the rock over the edge and started running downhill and accumulating more rocks. You know what I mean? And so he created a malleable state, and I was then able to mold it.
Excellent. Philippe, did you want to jump in here before we have to let Doug go?
Thank you, Doug, very much for sharing your experience, because what you say is exactly illustrating what we know now in state-of-the-art brain physiology with respect to neural plasticity and enhancing cognitive processing, which is the core engine and the processing, the software allowing neural plasticity, which now is well known out there. Thank you, Doug.
Doug, thank you very much for taking the time to be with us on the program today. It's really enlightening, and it's always encouraging to spend a few moments with someone who has benefited from NeuroKinetics and the crew down there. And it certainly sounds like you've managed to get your life back on track. Thanks so much for sharing it with us, Doug. We appreciate it very much.
You're very welcome.
Thank you very much, Doug, again.
You're welcome.
We'll take a quick break, and we'll find out exactly what happened there, what Dr. Philippe and the rest of the crew at NeuroKinetics did to help Doug and other patients dealing with traumatic impact and disconnect issues when we return here on CIL 650's Boomer Life.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CIL 650. We're back. This is Boomer Life on CIL 650.
Oh, dear. Welcome back to Boomer Life here on CIL 650. I'm Sterling Fox, joined in studio by the group from NeuroKinetics Clinic in Vancouver on Granville Street at 16th. Our guests in studio are the clinic founder and president, Philippe Souvestre. Sonia Dale is the clinic manager. J.C. Gordon is the clinic's director of liaison and logistics. On this program, we're talking about trauma, impact, and disconnect. We were very fortunate to, a few minutes ago, have heard from a former NeuroKinetics patient, Doug in Vancouver, talk to us a bit about his experiences. And Philippe, let's talk about what you did with Doug. Now, not everyone is in the unique position of being able to afford to go to clinics in California and across Canada and elsewhere, seeking out trying to find out what's wrong. Doug was a successful businessman, had a few bucks, and spent them in ways that he thought could help his development. He was suffering from disconnect due to some kind of traumatic event. So eventually he finds his way to NeuroKinetics and to you. And I would imagine, and Sonia, of course, you would have talked to him first, when a patient like Doug, with a long history of clinical appearances elsewhere, says, can I come see Dr. Philippe? Do you ask them to bring the paperwork from their previous clinical experiences along with them?
Yes. If they can, and if they don't have the records, then what we do is the time they do come in for their appointment, I will get them their authorization basically to have those records sent over to us directly.
Okay.
To assist in that process for them if they don't have the records on hand with them physically.
Dr. Philippe, now this is a guy who comes to you and says, I'm totally disconnected. I'm out of it. And somehow or another, you are able to determine that this has a lot to do. And he told us he was delivered as a baby. The obstetrician used forceps in the delivery and caused some brain trauma to his temporal lobes. And that inhibited his brain development from day one up until he became a patient of yours, probably in his 50s by then, right?
Yes.
So did you know that when he came to see you, did he know that the traumatic event that caused the disconnect that he was there to see you about was his delivery at birth? Did he know that at that time?
Not at all. We discovered that through the process. It took these 3 sessions of assessment to identify the length and the extent of his trauma history.
Right.
And his developmental stages, pattern. And we identified that he lost a part of his capabilities to grow up and catch up cognitively and with a normal brain psychophysiological development.
Right.
Yeah. But he was not aware at all on this.
So interesting. So this, and I would imagine that this is the case in a lot of instances where you see patients who come to you and say, look, and in Doug's case, my gosh, how many clinicians and practitioners had he seen before you? I would say probably dozens.
Yes.
And so many patients come to the clinic going, look, I've seen my share of docs. And so far, no one has, as Sonia says, in many cases, they don't even get listened to respectfully,
right,
let alone treated so. And so they have, in many cases, you just somehow or another have a way of unraveling a patient's history to the point where you're able to identify the event, that single event that has caused all of the distress for however many years.
I am on a hunt for that.
Okay. Now, Doug mentioned specifically, and I'm coming back to this because we did it last month, too. We had a young cyclist who becoming a champion or on his way, and he had talked about something in the balance test. Now, Sonia,
right,
in the past, you've described where when someone comes to NeuroKinetics to seek out the services of Dr. Philippe and the rest of your team, first of all, there's that one meeting in which the individual sits down with you and JC and others to talk about what the clinic might be able to do for you.
Correct.
And is this going to be a good fit?
Yes.
And if it's determined that it will be, then and only then does the patient agree to go forward and go through those 3 4-hour assessment moments with Dr. Philippe, correct?
Yes, that's correct.
So, okay, Doug now has seen you, Philippe, for 12 hours minimum. How long did it take you in the process of that 12-hour experience to identify that this guy's problem actually quite literally goes back to day 1?
It takes the 12 hours plus.
Okay.
It is an ongoing discovery through the process.
Okay.
It's like any investigation. I am trained as an investigator. I was trained in France as a post-crash aircraft crash investigator.
Okay.
So I have been trained as an investigator. And you begin to build up your map. You map out what you see, and you look for correlating and taking the dots in a process.
Mm-hmm.
So what you cannot explain at a given stage, you put it aside, put it on a map with a big question mark, but you keep it inside.
Sure.
And you pursue your investigation.
Move on,
And at
right.
some point, the puzzle, you pick that bit because that bit is actually missing somewhere further down on
Right.
the map.
Okay, now let's talk about the balance stuff. Again, going back to our young bike rider there last month, and now Doug, a much older individual, probably going to respond to those physical tests quite differently. What is it about, because Doug said, he told us, just by watching a person's eyes and watching how they stand or do this on command, also can tell you a lot about that person's thought processes. So
Yes.
what is it about the balance test that works so effectively for you?
Okay, the balance test is only one of the tests
Of
we
course.
use in our battery.
Absolutely.
It is a fundamental one, though, which is not really well understood in general mainstream approach of trauma. To make a long story short, it ties with what we know now about brain functionality, and I would dare to say the equation that goes with it that allows to quantify the amount and quality of the cognitive processing, which is again the software necessary for the brain, which is only anatomy, to work out
Sure.
all the beautiful types of performance we are able, whether physical or mental, including intellect and intellectual, emotional, and executive as well, which are complex actions. So we use this test using, as an example, the balance test, and we have a very accurate protocol which provides us with a lot of data which reflects the quality of the sway, the quality and the magnitude of the sway. Well, those data also belong to a set of multifactorial capabilities which are, as we say in our domain, operate in a brain in synergy with each other, which is in harmony with each other, and each of those components being necessary to perform a good sway.
Okay.
Talking about balance
Right.
test. So it ties with this equation, forgive the hardcore a little bit here, but the equation that reflects the bridge between physical performance and mental performance.
Okay, sure.
And in that sway data will allow app entries to understand dysfunction that could, through sway alteration, reflect mental factors and physical factors, brain-wise.
Right. Sonia, you mentioned that after a person goes through the typically approximately 12-hour intake process, 3 assessment meetings, 4 hours apiece, preferably one day apart, doing 4 hours and come back the next day for another 4
Yes.
hours and then come back the next day for another
Yes.
4 hours. So there's 12 hours with a doctor that a lot of these people have probably never had. Not many of us get 12 hours with a doctor over 3 days unless we're in really bad shape.
Yes.
And I'm talking about, operations and such. But this is a whole different ballgame, isn't it?
Right. It is.
So how long, once the treatment program, after Philippe has had a chance to assess the patient and determine the best method for restoring that, optimizing that person's brain, to use your phrase, JC, so it's typically what, about 12 weeks?
Average of 12 weeks is a program that we've looked at and we've averaged out roughly for most patients here in the clinic. So you would say, I'm going to say minimum 12 weeks.
Okay.
So they come into the clinic, and we found that 12 weeks is usually the bare minimum that they do need. It can go up maybe a week or few weeks, some on the severe side of things to a few more.
Right.
However, 12 is the minimum. And then treatments range from anywhere, to, 2 sessions, treatment sessions a day to, depends on the time of 90 minutes to 60 minutes, depends on the time and what Dr. Philippe suggests for them from there.
Right. Philippe, also during the 12-week treatment period, Doug described, and I love the way he described it too, he said because of this traumatic event at birth, his brain development was compromised to a certain degree. So there were certain things in his life that most of us experience that he had never experienced because his brain didn't allow him to. It just didn't go there.
Yes.
So how long into the treatment program did you discover this and Doug start to be overwhelmed by sort of the updates that were coming back to him since that traumatic event at his birth?
Okay, what you mentioned here reflects to patterns we are looking at.
Okay.
And they can highly vary from between individuals, and which means between trauma histories, as far as trauma impact is concerned. And in Doug's case, as an example, and seen from the top of the hill, a few progresses have been seen pretty early in the program, but they were still vacillating. They were oscillating. It's like a flower starting to open, but then there is a resting pause, and then pushes again, and each time it's with a greater magnitude, right, and greater completion in the opening of it. And that's what we very commonly observe. It is a very beautiful time to see that. We have expectations before starting the program in the light of the assessment data. We have an expectations of what is going to happen. We have this capability. That is the type of method we use that allows this to foresee. So we set we have expectations.
Sure, of course.
And we are now doing through the awakening phase of this dormant brain in some areas.
Exactly.
And through stimulating the proper connections, which relates to body energetic using Eastern medical techniques and procedures in the light of the Western body of knowledge about neuroscience and anatomy and physiology as we know it in Western medicine. That is also a beautiful model that allows to monitor and get this awakening process on.
JC, you like to use the phrase brain optimization a lot. Let's apply it to Doug's context here, and how quickly it happened. I mean, 12 weeks is not a very long time, especially for a fellow who'd been going to clinicians in Canada and the United States. He'd been on a long journey and achieved very little satisfaction. And all of a sudden, he's in NeuroKinetics, and inside of 12 weeks, suddenly life is, as Dr. Philippe just said, is blooming. So how apply the term brain optimization to Doug's case?
Sterling, if I could simplify the brain optimization process that happened to Doug, it would be like converting his pre-NeuroKinetics software from an XP program of dysfunction into a Windows 10 version of function.
Gotcha.
And that's the simplistic overview of what happened with Doug. And Doug so eloquently last session talked about what that meant to him, because he had lived the first 50 plus years of his life in an XP program, and all of a sudden he's being introduced to a Windows 10, and he had to reassimilate himself into the world to actually realize what his true potential really is. And that's what brain optimization can do. It unleashes our true potential.
Allows him to discover the infinite resources of the brain. That's the one thing that we're told, Philippe, and I find this incredibly challenging and frustrating. We're told that human beings throughout the course of a typical lifespan will use less than 10% of our brain's capacity. I find that frustrating because I'd like to find out how to use more, and challenging because, by gosh, I am going to find out how to use more. Is that typical? Is 10%, is that a number you're comfortable with?
It varies with individuals,
of course. But so, on average.
Yes, on average, I would say yes.
Isn't that something, eh?
And it ties
all that untapped stuff going on.
It ties also with misconceptions about what we can do with our brain.
Right.
And lifestyle will also adversely impact on brain capabilities. And we mentioned earlier in past shows as well about how one may be led to reach help and support using addictive patterns and modalities to just keep boosted and operate, able to operate. And that is the side effect and the double-edged sword we have in our lifestyle. And when it is adverse, that will alter and prevent to go beyond the 10% we want to.
The challenge is always, it's going to be there for the rest of my earthly days. How to get at that remaining 90%. Our guest from NeuroKinetics Clinic, if there's anybody in town who would know more about getting to the 90%, it's Philippe Silvestre and the team at NeuroKinetics at 3195 Granville Street here in Vancouver and online at NeuroKinetics.com. Back with more on Boomer Life after this quick timeout.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIL 650. We're back. This is Boomer Life on CIL 650.
Well, I suppose we should play the connected song on an episode of Boomer Life with the NeuroKinetics gang, in which we discuss, trauma and the potential for withdrawal and disconnect after such events in our lives. Our guest in studio, Philippe Silvestre, the founder and president of NeuroKinetics, and I must hasten to add, a very recent inductee into the International Academy of Aviation and Space Medicine in a ceremony at Oxford just a few short weeks ago. And again, our congratulations to you, Philippe. Also in studio, Sonia Dale, the clinic manager. J.C. Gordon is with us, too. He's the director of liaison and logistics. We're talking about trauma and disconnect. And I suppose, Philippe, back to you. We heard from Doug, who had been a kind of a disconnected guy for a very, very much of his life. So how do we know when we're going through a disconnect, or someone close to us is going through a disconnect, that we may feel the need to help? What are we looking for?
It depends on the severity of what is going on. Sometimes it will be very obvious, like somebody being totally unable to operate, whatever since always.
Just sort of withdrawing.
And also being incapacitated.
Okay.
Not being able to perform in a domain you would expect that person to be able to perform.
Right.
So that is the blatant side of things. Most of the time it is more subtle than that, and it will be translating about people avoiding things, withdrawing, gently, shy.
Mm-hmm.
I don't believe very much in shyness since I have become the professional I am, because it is a way to withdraw and stay away from things which could be overwhelming, and when one would find oneself into a place where there is an inability to adapt.
Okay.
So that would be the trigger, the thing to look at.
Okay.
If someone is avoiding situations and is unable to adapt to it, I'm talking about daily life and plain, gentle situations, that is a big sign.
Okay.
So shyness, withdrawal, I don't believe in laziness either because of that. It is that unpreparedness which cannot be compensated for, this inability to face and adapt to a new or known situation.
Sonia, you've talked to us in the past on previous shows about people, and I recall one example. A woman eventually came to the clinic, and she was suffering from depression and a disconnect, a very serious disconnect. Mm-hmm. But she was so isolated and so withdrawn, as Philippe has just described, she decided, okay, I'm going to get some help. I've heard about NeuroKinetics. I'm going to give them a call. Between the time that she took that decision and actually called you, 6 weeks went by. It took that long just to screw up her courage to pick up the phone and get something done. Yes. Some people are so withdrawn and disconnected, they can't do it for themselves. Do you get calls from people going, look, my son, my husband, my wife, my grandmother is having some problems here, and I don't know that she's even able to identify them, but I sure can. Can I bring her in?
Yes, and actually even for, general people calling us in for themselves, we normally do ask for somebody else in their life that is supportive, to them and of everything in their life, to bring them along, because a lot of times the other person is able to observe things that they're not able to see, or they may forget.
Right.
In this case, like you're saying, if it's for their son, their daughter, their boyfriend, their husband, their wife, whoever it is, yes, they do call us because they are seeing things that maybe the other person is either denying.
Right, sure.
Right? Or either they cannot see it.
Or they just don't see it.
They just don't see it. And it gets to a point where the person, once we do get to speak to them, their self-esteem is affected because they're hearing this all the time. Hey, you're being like this.
Right,
hey, you're
right.
isolating yourself. You're not doing this. You're
Stop
not doing
being
that.
so weird.
Exactly.
Right,
That's
right.
the main word. It's
Right,
weird.
Right. Okay, Philippe, we don't have a lot of time, but I need to ask you this. Is autism a form of disconnect, or is it a whole other thing? I just got to throw that out there. As I say, we don't have a lot of time, but help me out on this one.
Short answer, yes.
Really?
More extended answer, I think it may be a good idea to dedicate a show to this. This is a very vast question.
Okay, and it seems to be more prevalent as time goes by. So can we get you to talk to us about autism on a future program?
I'll be glad to do that.
Excellent. NeuroKinetics, by the way, in the meantime, if there's someone in your life that is perhaps you're more capable of seeing the need for some assistance than they are, as Sonia has just identified, get on the phone. Give them a call. NeuroKinetics website, by the way, is neurokinetics.com. All the information, Dr. Philippe's contact point, JC, Sonia, the phone numbers, the address on Granville Street, 3195, by the way. There will be no test, but it is 3195 right there at 16th at the bottom of the hill. Give them a call. Check out the website. All the information is there. And for goodness sake, as our friend JC likes to remind us time after time, it's the place that offers hope.
Absolutely. Absolutely.
Thank you all, Philippe, Sonia, JC, for coming by. It's always a treat to have the NeuroKinetics crew in studio.
Thank you, Sterling.
It's mutual.
Always a pleasure.
And we'll talk autism next time, okay? Excellent.
Sure.
See you next time here on Boomer Life on CI.